Hello, everybody. Welcome to the Ohio Program for Campus Safety and Mental Health webinar. We very much appreciate you all joining. My name is Russell Spieth. I'll kind of get it started, and then I'll move it over to Jessica. What I want to say first to all of you who are listening is that we just are so happy and with the support that you've been giving to the students, your colleagues, other professionals that you're working with. I know this time is incredibly challenging. The work was already challenging, and it's only gotten more so, and we're all having to figure out new ways to keep ourselves well and our families well, and as well as try and help the students that we see, as well as our colleagues. And it's incredibly challenging. Like many of you, I am like pivoting from my work to helping my fifth grader with math, to helping my 14-year-old with his stuff, and which is why I have a picture of my dog on here, because my dog, I think, is the only person the only entity that's thriving right now in my house, because he likes that we're all home. But anyways, I just do want to send a warm thank you to all that you're doing. So I think that's my main stuff, right, Jessica? Did I get it?
Yeah, I think you summarized it well, and let me just introduce myself to everyone. My name is Jessica Zavala, and I work alongside Dr. Russell Spieth in the Ohio Program for Campus Safety and Mental Health. And I also echo his words in recognizing that this may be a challenging and difficult time for all of us. And so we thank you for joining us today, and we certainly have been putting out resources on our listserv as well as our Twitter handles. So feel free to follow us and take advantage of some of those resources and other programming that we've shared that's available.
Yeah, thank you, Jessica. And one other quick thing, we'll probably send out a survey around this later. We survey every while, every period of time, we'll survey you all to kind of get a sense of what webinar topics you would find interesting. So we'll probably do that again around May. But also, we were just having a conversation with the medical director for Summit County Board of Mental Health, and we were having this discussion around how many people fail to realize that for mental health issues, sometimes the distress comes after a good period after the actual incident or event. I know I'm preaching to the choir here, but what that means obviously is that our students may be exhibiting more distress into summer, beginning of fall. And I think it's important that we educate others about that. And Jessica and I are going to think about ways that we can help collectively advocate for the resources we need, which are already limited. But we're a little concerned about how some may believe that, okay, once the COVID-19 issue is gone, we don't really need to worry about, student mental health as much or what have you. And obviously we would anyways, but it's likely there may be more distress later. And sometimes people don't really appreciate that. So we're going to think a little bit about that and how that we can maybe collectively advocate and get a sense of what we need. So we're going to do our topic, which is motivational interviewing. I'm going to kind of thread my bio through this. I have been using motivational interviewing since about 1995. I started using motivational interviewing in New York City when I was working predominantly with people who were gang affiliated, substance use, and criminal justice involved. And that's sort of where I was getting my master's degree at Columbia University at that point in time. And one of my professors, who was my favorite, was kind of teaching me motivational interviewing, which was really helping me to engage those clients much more effectively than what I had been. And interestingly enough as well, I got my bachelor's degree at Florida State University. And some of y'all know my story, some of you don't, but I had a substance use disorder issue that I'm in recovery from, as well as other mental health issues that were really springing up in college. And I was mandated to college counseling, and which is one reason why I love college counseling. And I'd seen a lot of providers before that point, and typically felt sort of disrespected, not empowered, certainly, and like the relationships were always oppositional. And I don't blame any of the providers. I had my own mess that I was going through. But that being said, my last substance use counselor, who was a counselor at Florida State, was using what I learned later was motivational interviewing. And it was the first time I felt really activated to make a change and felt like this is a person who I could actually get real with. So it's kind of interesting that when I was beginning to learn motivational interviewing myself, I thought, oh, that's the intervention that that person did with me. And so it's always felt like home to me. And like I said, I started in 1995. I've used it with college students for 5 or so years. I've used it with people who are homeless. I've used it with a variety of populations in New York, in Cleveland, and Akron. Now, currently, I train medical students and pharmacy students at NEOMED in motivational interviewing. I've also trained a number of other types of allied health professionals for about 10 years. So that's kind of the point where I come from. Jessica and I are going to start off with a little role play, just brief, because the research on motivational interviewing suggests that the best practices in terms of learning it and being good at it are a few things. Each presentation should have a role play. There should be some practice. We can't really do that in this arena. And then people need to practice and then have feedback. But at least we can get try and make an attempt at a role play. And it'll actually be a little bit like telecounseling, which many of you all are probably doing right now, maybe for the first time. So we're just going to do a brief little example of something that comes up a lot when I was seeing students. And just a couple of minute thing just to kind of give an example. So, hey, Jessica, how's it going?
Hey, Dr. Spieth. It's going okay.
Yeah, okay. That wasn't the most believable okay. What's going on?
Well, this semester has it's been pretty challenging for me. Just academically, I don't feel as though I'm doing my best.
Okay. Well, I appreciate you saying that. Like, it takes a lot of courage to be honest about that type of thing. So I want to just say that, first of all, I appreciate that. So, I know we talked last time I saw you about that calculus test that you had coming up. I'm wondering, is that kind of one of the things that's on your mind?
Yeah, I am. I'm really struggling in that class, and it's even hard for me to even talk to my professor about it. So it's really hard.
I get it. So you kind of think that it may be beneficial, and at the same time, it's kind of scary to approach them.
Yeah, and it's just really me. I just can't seem to get the courage to talk to him about how hard this class is for me. And, I have a lot of other things going on outside of class as well. And so it's just really hard. But I mean, I want to do well academically.
Mm-hmm. Tell me again, like, I know it's just important for us sometimes to remind ourselves, how come this class and doing well academically is so important to you?
Well, it's important because of my major and what I want to do in the future. This calculus class is part of what I need as a core credit to graduate. And I need to do really well so that I can move on to the next part of my program.
Mm-hmm. So it's really, it's about your career. And this career you envision for yourself really necessitates doing well in this class.
Yeah, that's really correct. Yeah.
Okay, I hear you. So, and I get it. It's a normal thing. Many of us get fearful of talking to people in authority, right? But what are the reasons why you were nervous or kind of wouldn't want to talk to your professor?
Well, I really don't want to talk in front of the other students because a lot of people at the end of class, they'll go up and talk to the professor. And I'm kind of nervous about talking in front of other people. Mm-hmm. And to be honest, math has not really been a strong subject for me, throughout high school as well. And so I'm afraid that maybe the professor may have some, really not so nice things to say to me in front of other people. And it'll embarrass me, to be honest.
I hear that. Like, you don't want to feel ashamed and you're concerned about how other students may react, but also your professor, and you're concerned about what that feedback's going to be or how you're going to be treated.
Yeah, that's exactly it.
And I get that. Would there be any other reasons why you wouldn't want to approach the professor, even like, during office hours or what have you, where hopefully it would be more private?
Well, just probably my own anxiety and, just I want to do well, but, like I said, I have a lot of things going on outside of class and, my home life and everything. So there's timing and everything with the office hours. And so it just really makes me nervous to talk about this.
It sounds like life is just kind of overwhelming in general. And for one thing, it may be hard to even make the office hours. And if you did, you may be having to give up other things in your life. And you're just going to be even more stressed to have that conversation.
Yeah, and really even forming the words like, how do I really even go about this conversation? And how do I really request extra help? And, I don't know what all resources are available. And even if he would be willing to help me out.
I get that. On the other side, like, what are some reasons why you think it may be a good thing to face this real anxiety and nervousness around it and nonetheless approach the professor for help?
Well, as I stated, it's a really important class for my major.
Mm-hmm.
And so there may be other classes in the future that I might need help with. And so it would help me to have these skills of how to communicate with my professor.
Mm-hmm.
And even I think about the future career I want to have, I'm going to have to communicate with other people, potentially even colleagues. And so I think building and having this skill of communication and working on my anxiety would just put me really in the right direction.
That's really insightful, and I may even say cool. What you're saying is that it's important for the short term and for this, this barrier that's right in front of you. And at the same time, you realize that this is a skill that you're going to need to learn, is to ask for help, because we all have to ask for help. We all get in situations, career or academically, where we don't know how to proceed. And you think this is a good opportunity to begin to get some progress in that area. That's really awesome. Any other benefits you think there would be to having that conversation with your professor?
Well, I mean, I can really even seeing it help me in my personal life. I have a few personal relationships some situations that I've been avoiding. And so I think, it would help me to build up the courage of how to have conversations with other people too. And so I really look at it as an opportunity to really overcome barriers and fears with other issues that, I'm experiencing, including some problems that I have even with drinking sometimes.
Okay. So it's broader than that. This could be really like a lifestyle change that could help a lot of different aspects of your life. And maybe even some of those things that are so overwhelming in your life may begin to feel a little bit more rectified if you could begin to be more assertive with people and ask for help, I guess, is the more specific way to say it.
Yeah, because as I stated, there's so much that I want in the future and for my career. Mm-hmm. And if I address this, then I know maybe this will help me to, reduce my fear, reduce my, my urge to drink on the weekends, or my urge to drink after I'm in like a really stressful situation.
Okay. So, it sounds like you're on the fence. I get that. There's a number of reasons why, it's scary and maybe even from a time perspective, too challenging to be able to find time to meet with your professor. And on the other hand, there's a number of ways that you think this could improve. It could improve the immediate situation with the class itself. It could improve the way in which you interact with people in general, and also to really be kind of a way of enhancing your career. And I get that. Based on being on the fence, like what do you think is the right direction to go in at this point?
Well, I guess I really need some strategies of how I can approach my professor, and what would be the best way to interact with him and to go about that. So I think that would be a start, to really look at some helpful strategies to approach him and to talk about my struggles academically in this course.
Okay, that's awesome. And again, like I know I've said this twice now, it takes a lot of courage to commit to an action like that. So would you be open, this is how I'd kind of end it, would you be open to us doing some kind of role plays about ways that you could discuss that with your professor in ways that make sense for you?
Yeah, I think I'll be open to that.
Okay.
Yeah.
All right. So time out there. I'm going through the presentation, I'm going to try and kind of highlight some of the things that I was trying to do in that encounter with Jessica. Thank you, Jessica, for doing that with me. So what we're going to be doing is understanding how MI can improve student health outcomes, recognize how MI can improve student academic performance, think about the MI spirit, and also look at some of the skills of motivation interviewing to evoke change talk, to soften, sustain talk, and to create a change plan. So that's going to be kind of the ideas. These are a few different definitions. One is MI is a motivational approach that's evidence-based. And on the evidence-based part, there's been close to 1,000 randomized clinical trials across the world that suggest that motivational interviewing is generally more effective than the typical kind of telling people what to do, educating people, advising people. It's brief. It can be done in everything from 5 to 10 minutes, and there's research that suggests people can do the intervention in that brief of a period of time. Or obviously for those of us who are counselors or psychologists, with some clients, I do this with, 10 minutes for each time I see them, right? It's applicable across a wide range of problem areas. I mean, literally everything from teenagers flossing their teeth to people with schizophrenia, exercising more, to elderly people curbing their opioid misuse, to college students curbing their drinking behavior. And it can be learnable, and there's evidence to suggest a broad range of helpers can do this. That's one of the things I've always loved about MI is when you're collaborating with the folks in your health department or health departments collaborating with those of you in the counseling center or advisors or whatever, motivational interviewing is something that we could all do. And it's an intervention that's got evidence to suggest that a number of different types of helpers could all use this intervention. The other conversation I like is arranging conversations so people talk themselves into change based on their own values and interests. So when I was with Jessica, that was one of the reasons why I said, hey, would you mind telling us again, how come this class is important to you, right? And that led her then to, again, make the connection for herself. I need to do well in this class because that's my career, and that's the career I want. And then it also kind of came up in our conversation that this also related to other parts of her life. So if I was continuing to do MI with her, I would keep wondering how beginning to ask for help with people would affect a lot of the things in her life, right? Because ultimately people want to change or will make a change because they believe it's going to ultimately benefit them in something that's important, right? And which is why, like those of you who use acceptance and commitment therapy or do other types of value clarification interventions with people, or just in general helping students clarify values, this can be really important because it can really help you understand how to motivate people. For example, I've had college students where they were using marijuana and they were still living in their household where they grew up, and they had a value of being a good role model to their younger siblings. And so I would ask really neutral questions about, well, how do you think, smoking weed impacts your ability to be a role model to your son, to your younger brother? And not in a heavy-handed way. You always want to ask the questions neutrally so that people have the opportunity to answer and not feel like they're being judged. This is one of the things I like to think about when I'm working with people is, there's a bunch of different ways people can work on feeling better. And this is from SAMHSA, Substance Abuse Mental Health Service Administration. These are all empirically supported, broad, areas in which people can improve their sense of well-being and their mental health. So sometimes when I'm working with somebody, they're not exactly sure in what direction they want to go. I'll go through this with them and describe a little bit of examples of each one and kind of see what's the thing they want to work on, right? And I like this because it keeps me from having kind of my biased way of, oh, well, everybody needs to do cognitive behavioral type therapy, which is great, right? That'd be kind of the optimism based on positive expectations and cognitive skills to avoid negative thinking. That's great, but some people may think really it's more. I've had clients who say they believe they've turned their back on God and that they're lack of religiosity is really one of the things that's impacting them. So with that person, I'm probably be working more on helping them get more engaged in what it means for them to be religious, right? But one example of this, I was working with an international student a couple of months ago, and we were kind of going through this, and he became aware that his depression was likely related to going from more of a collectivist culture where he moved from to being in a more of an individualistic culture, which is the United States. And he began to really have an epiphany of that the way in which he was relating to people was what he believed was attributing to his depressive symptoms at that point. That's like support network. So, you know, and what we kind of came up with collaboratively was that he was going to begin to create this, like he and his friends who worked in the lab together, they cooked meals collectively twice a week. And it was amazing. Like after, you know, a period of weeks, through engaging with people in that way, in a way that was much more natural to him, he was beginning to feel much more satisfied with his life. So it's kind of an example of you never really know what's going to exactly work for a person, and it's therefore important to have an open mind and a variety of options, and also allow them to direct you, right? Which we'll kind of get at. Really quick, these are just some of the. There's hundreds and hundreds of studies. I want to show a few that were just kind of interesting because they were the providers you typically don't think about. So this is a randomized control study, and it was with a physician in a student health center. And people were randomly assigned either to 15 minutes of motivational interviewing or 15 minutes of a typical kind of educational encounter. And it was based on students who, in a screening, had endorsed harmful drinking. It was a 12-month study. So you can see there's like almost 500 people in the control group and about 500 in the intervention group. And what they found at 12 months, and this was just after one 15-minute encounter, was the group that had the MI condition, they reduced their 28-day drinking total. So they would look at it on a monthly basis, how many days of the 28 were they drinking, by 27% versus by 21% for the control group. That was a statistically significant change, and then also significant reduction in the students' reported alcohol problems based on the Rutgers Alcohol Problem Index. So it's just kind of interesting because that was just a 15-minute encounter with a physician in a student health center where the students weren't even coming in for alcohol use. It's kind of like SBIRT a little bit, but so this is another interesting study that was, this was about studying for exams, and this intervention was conducted by a teaching assistant. And essentially what they did was teaching assistant came in and did a brief 15 to 20 minute MI intervention during class with the goal of increasing student study skills, or not studying activity. And they found that there was a significant improvement in grades with that 15-minute encounter from the first test to the second test. That was kind of like a longitudinal study. This is not specifically to medical students, but I always like to, medical students, you can see who I teach, not specifically to college students, but I like it because this isn't just self-report, and this is a big meta-analysis. So essentially this was about 80 studies that were looking at actual biomarkers of change. So they were looking at body mass index, A1C, total cholesterol, blood pressure, cigarette smoking, and they were doing actually a nicotine assessment, tox screen, and blood alcohol concentration. And they found that MI produced significantly better outcomes than traditional advice giving and education in 75% of those studies. In none of those studies was motivational interviewing less effective. And they found that in 64% of the studies, there's a positive outcome just during a 15-minute encounter, much like the one we referred to with the drug and alcohol, or the alcohol issue. One thing I would say about this, though, the research on motivational interviewing suggests that the closer you are to fidelity to motivational interviewing, the more likely the person changes. So it's very much like any other intervention. The better you're at it, or any other, any evidence-based intervention, the better you are at it, the more likely patients change. And there is a fidelity scale And I listed it in the motivationalinterviewing.org website, which I have in the reference section. You can access that for free. I use that to teach medical students because I want to teach them to the fidelity of the model, but it takes hours to do that. We can't do it in this kind of a session. This is the last one. This is kind of interesting to me too. There is research to suggest that motivational interviewing decreases provider burnout. And there's a few different reasons why we think that is. One is that motivational interviewing is really about the process more than the outcome. If you adhere to the process, the outcomes will take care of themselves. And it's meant what that really means is the goal is that you're trying to promote the student's own agency to make changes and really appreciate that you're not responsible for their change. Yes, we can influence it, but we're not responsible for it. But also the thing that's cool about MI is that, like I mentioned before, a number of different types of providers can learn it. So I've worked in a couple of community mental health centers where peer support specialists, case managers, psychologists, psychiatrists, physicians, nurses all learned it, and we all practiced together. And it increased the cohesion across all the providers. We would have fun practicing together. So I think it also, it helps with cohesion because we can all do it. And even if you're a clinician, people who use CBT can use MI. People who use DBT can use MI. People who do trauma-focused therapy can use MI, because MI is oftentimes used to get people to engage in another evidence-based practice like CBT or dialectical behavioral therapy or exposure therapy. Okay, so this is the basic kind of underpinnings. They call it the MI spirit. This is sort of like the way in which you're thinking about working with people. And the first element is partnership and collaboration. So it's this appreciation that it's two experts coming together. Your student that you're working with is an expert in their own life experience. They're an expert in what they're willing to do. They're an expert in what they're not willing to do. They're an expert in why they would do it. You also obviously are an expert in whatever your discipline is in your own life experience. So, and really, I think even with students who are doing things that we find kind of disturbing maybe, or we have stigma toward, like maybe non-suicidal self-injurious behavior or drug and alcohol use or being in a domestic violence relationship. Sometimes those issues we get more kind of directive or more prescriptive because maybe we're just really concerned about the student or kind of think maybe they're just at a very diminished level of functioning. The research suggests that really, nonetheless, having this partnership and collaborative stance for all of our patients is going to increase outcomes. And the only caveat is obviously if someone is a imminent risk to seriously hurt or kill themselves or somebody else, then you're at that point getting that person the help that they need. Though you would use MI after that, after you've started working with them again. With Jessica, like I was trying to demonstrate that by kind of wondering, okay, first of all, with all this going on in your life, is this something you really want to focus on? And then wondering if she'd be open to the two of us doing a role play and practicing. And I asked her permission. Is that something you want to do? If she said, no, I don't want to do that, then we would figure out something else. So it's a lot of like asking permission, asking people's ideas about things, wondering what they think about things. The second element is acceptance. One quick thing about partnership collaboration. Like you, or potentially like you, I work and have worked with a lot of international students or people who just wanted me to really wear the expert hat. So one thing I kind of learned, because MI is my style, is when I'm doing my own kind of informed consent with students, there's the formal informed consent and there's kind of like, what is Russell and what's he about? I let people know that my style tends to be collaborative in nature, and I explain that what that means is I like to hear your ideas. I like to share my ideas if it's okay and come up with a joint decision about how to proceed. And I ask students, how do you feel about working with me if that's my typical style? And every now and again, I've kind of, at one point I used to actually rate it or tally it. about 10% of my students would say, you know what, I really just want you to tell me what to do. So, I would kind of explain that, yes, I'll do that, though there may be some issues with that because we're different people with different environments and different, factors affecting us, things even related to oppression or privilege. So I would kind of speak to that. But if they wanted me to give my advice and kind of direct them, that's what I would do, because that's partnership and collaboration as well. So just to kind of let you know that for some students, they may want you to be the expert and kind of how you're going to think about doing MI with that. The second part is acceptance. So there's the accurate empathy. I was trying to do that with Jessica, where I was doing a lot of reflections. I was reflecting a lot of things with her to try and make sure that I understood her experience. And I did it through statements sometimes, and also questions. But generally, it's being overtly empathic with people. Absolute worth is basically just those clients that you kind of want to hide under your desk, and we all have those clients and we don't want to see them. And that's normal and it's human, and to deny it would be unfair to us. Nonetheless, somehow you got to get it together to do good, competent, ethical work with those folks. So it's just really trying to do those mental exercises of finding the real value and strengths in those clients that maybe are harder for us to work with, and seeing the good in all people, and that people are generally doing their best. And sometimes what they're reacting to has nothing to do with us, but it has to do with trauma they've experienced or bad encounters they've had with people like us in the past. And it's just trying to really understand the person. Emphasizing autonomy is just the notion that people have the right to make decisions. In that encounter, Jessica definitely had the right to not go see that professor, to kind of avoid asking for help, and to, let that happen. And if she'd have said, this is a good conversation, but I think I'm just going to keep doing what I'm doing, I would have said, okay, at this point, that makes the most sense to you. I get it. And part of why you're doing that is just to help someone really understand their agency as a human being. Also, it's non-judgmental, and I would argue, and so would the research, that she would then be more likely to come back and say, hey, you know what, my way is really not working. I am open to doing something different, because she would have already felt like I had respected her. And affirmation is trying to catch people being good. So I was doing that by even her honesty. Students don't have to tell us that they're not doing well academically. Students, she also was mentioning the alcohol. She threw me for a loop on that one. We didn't really practice beforehand, which we both like to do it on the fly. So I could have affirmed that too, like really appreciated her honesty about telling me about her drinking. But affirmation is just trying to catch people being good, trying to affirm them, to acknowledge their strengths. And what you're kind of going to hear a little bit later on is people who study motivation think it's comprised of importance and confidence. So for someone to make a change, they have to feel like it's important to make that change, but they also have to be confident that they can do it, or that there will be a good outcome if they do it. Affirmations work on the confidence piece. Acknowledging someone's strengths may be activating for other parts of their self-efficacy. Compassion, that was included in the latest MI book. Basically, be ethical, stick to your ethical codes. People are using MI to do things like encourage people to go into research studies or to go into revenue generating programs they didn't necessarily need. Don't do that. Stick to your ethical codes. Evocation is trying to figure out ways to get the person to talk themselves into change. So that was like when I asked her, well, how come this is important to you? And she then said, well, because this is my career, and my career is important to me. And that was her talking herself into change versus me saying, well, you have to get through this class if you're going to be able to have that career you want. That's blah, blah, blah. It's much more impactful if the person talks themselves into change. I do this with exercise a lot. Like a lot of times we want to tell people how exercise is going to make them feel more energized and activated and sleep better and things like that. I prefer to say, hey, tell me about a time in your life when you exercised regularly. What was that like? And then they're saying, I felt more confident and I was sleeping better and I felt less anxious. That's them talking themselves into change versus me saying, hey, you should exercise because of blah, blah, blah. But it's also trying to figure out how the person wants to change. So evocation is basically trying to figure out however you can to get the person to talk themselves into change. One other example I had with this was a student. A student is a few years ago, and this student smoked crack, and the student also had a strong relationship with God. They describe their higher power as God. And I was working with this person for a while, so I just didn't spring this on the person. But I said, how do you think smoking crack affects your relationship with God? In a really neutral way. And the person could have said, oh, well, I don't think it hurts it, or it does, or whatever. In this particular situation, the person got very tearful and really got really real about how she had felt like she was turning her back on God and felt like a bad Christian and things like that. And then she came back the next session and said, damn you, Russell. And I said, whoa, what's that about? And she said, now every time I'm smoking crack, I'm thinking about God. And that is really an example of developing discrepancy with her values. Smoking crack was incongruent with her values of being religious and being the way in which she embraced being Christian. She's always trying to figure out that and trying to get the person to talk themselves into change. I would never say to somebody, well, how are you going to be a Christian, doing what you're doing? Or how are you going to be a Muslim doing what you're doing? I let them say it out loud and be open for them to have variety of viewpoints on that. So the skills of MI, nothing earth-shattering, open-ended questions, and that's basically because you want the person talking as much as they can. Affirmations, again, catching people being good. Reflective listening, that's how you do that those empathic statements. Summaries with Jessica, I was trying to be quick with time, but that was sort of like, okay, on the one side, you don't want to talk to your professor because it's scary and they may be dismissive and, da-da-da. And on the other hand, and you're busy, and on the other hand, you would because you think this could help you in a lot of parts of your life and da-da-da-da-da. So it's kind of summarizing all the things that they described about their change. And then I said, based on that, what do you think you're going to do? Which is collaborative, right? Informing with permission is when you for example, if you do like CBT, you would say, would it be okay if I share with you how some cognitive exercises might help you to manage your depression? No, if you're going to ask that question, you need to be okay with the student saying, no, I don't want to hear about all that. Typically they won't, though. So the only thing that I don't ask in an informing way is my informed consent, because I have to do that. But aside from that, I typically ask permission before I educate people. Then I educate them. So you'd go through how, doing exercises around cognitive restructuring exercises could benefit their depression. And then you ask, what do you think about that? So you kind of ask permission, then you educate, then you wonder what they thought about your education. And it forms just a really nice, collaborative, respectful way of relating to people. Once I have a really good relationship with people, or I perceive that I do, it's always an open question, right? But I may stop asking permission to educate them about things, but I always ask them what they think about what I said, because that's really where the rubber meets the road. So complex reflections. So it's a major restatement. And so this is not parroting. This is saying something different, but close to what the person was saying, like kind of deeper. So if someone says, I know I should be doing my thought records for my depression, but I'm way too busy, I may reflect back and say, these exercises are not a priority for you right now. It's not what the person's saying, but it kind of is. Or I may say, to you, it doesn't make much sense to do these thought records, or you're wondering whether they'll really be helpful for you, right? You're kind of taking a guess at what they're saying in a deeper kind of a way, like what's the real thing they're communicating, but in the form of a statement rather than a question. So these are some specific ways to evoke change talk. I'm going to highlight just a few of them. So you can do the darn questions, which you'll see in the next slide. That's desire, ability, reason, need. Why would you want to curb your drinking? Ability, if you were going to curb your drinking, how would you do it? Reason, give me one good reason to curb your drinking. Need, how come it's important to curb your drinking? Elaboration. I had a guy recently who said, well, yeah, I drink sometimes, and sometimes it gets out of hand, but for the most part, I think it's cool or whatever. And I said, okay, so for the most part, it works for you, but would you mind telling me a little bit more about those times it gets out of hand? That's elaboration, right? And those stories are what winds up being motivating for people. Examples. You could also say, well, could you give me an example of when your drinking got out of hand? Basically, you're trying to get the story, because that story is probably going to be the thing the person doesn't like thinking about and might be the motivating force for them to stop. Decisional balance, this is super important. So when I was with Jessica, I asked her first, what are the reasons why you wouldn't want to speak to your professor? Then I asked why you would. Same thing with drinking. Tell me the reasons why you wouldn't want to stop drinking. What are the reasons why you would? Non-suicidal self-induced behavior. What are the reasons or the benefits that you get from cutting yourself? What are the reasons why you wouldn't? You start by asking what they like or what the benefit is to the status quo, because it really promotes that non-judgmental, collaborative, shame-free experience, and you empathize with it. I get it, like cutting yourself is a relief for you, and people have hurt you against your will your whole life, and this is the way you take control. So you empathize with it, but then you do ask on the other side, what are any downsides that you have to cutting yourself? And then you relate to that. It's really important you're doing MI, because it sets the stage for a relationship where people can be real and honest with you. Looking back, so that's when you maybe wonder about times when they were feeling better with their mental health. What were they doing? Times that they were feeling, stronger academically. What were they doing? Looking forward, kind of Jessica went there for us, looking forward in terms of what her career was going to be. If I was really working with her, I would have asked her a little bit more about that career goal, what she would be doing. How come that's important? The query extremes is when you say things like, for Jessica, I would have said, what's the worst thing that happens if you don't talk to your professor? You could substitute, what's the worst thing that happens if you keep smoking marijuana? And then on the flip side, what's the best thing that happens if you do speak to your professor? What's the best thing that happens if you do stop smoking marijuana? Importance and confidence rulers, we'll do that in a minute. And sometimes just exploring goals and values in and of itself can help people to make changes, because oftentimes, or most of us, are not living in total harmony with our goals and values. And sometimes being aware of that is motivating for people. So this is desire, ability, reason, need, questions. Again, you'll have access to the PowerPoint so you can look at them later. So importance and confidence. So you basically, when you're doing these rulers, I do them all the time. You say on a scale of 0 to 10, how important is it for you to, make whatever change that you're going to make? So for Jessica, it would have been, how important is it for you to speak to your professor? And maybe she says a 7. And I would say, well, how come a 7 and not a 4? And what you're doing then is evoking change talk. You're getting her to say the reasons why it is important. If someone gives you a 0, which happens sometimes, you just say, okay, that's not at all important to you, or there's no reasons to do that. And you've really learned that that's a person in pre-contemplation. If they give you a 1, you still ask, how come you're not a 0? Sometimes you get a little information out there. And you go to the next one. Confidence is the same thing. On a scale of 0 to 10, how confident are you that you'll be able to find a time to speak to your professor? Okay, you're a 4. How come you're 4 and not a 3? What would it take you to get to a higher number, like an 8, right? And again, this can help you with, first of all, evoking change talks. The person talks themselves into change. But secondly, it begins to let you know, where's the person stuck? Is it more importance or is it more confidence? Because your interventions are going to be somewhat different, and we'll get to that right now. Okay, so this is a person where we need to increase their importance. I really like getting drunk, but I could stop whenever I'm ready. So they're telling you, I'm confident, but I just, it's not important to me. So you can do reflections, like we mentioned. You have a lot of success making changes. You could do a darn question. If you decided to reduce stop, how would you go about it? That gets an ability. You could do that on a scale from 0 to 10. How important is it you to stop getting drunk? How come you're a 2 and not a 0? Also developing discrepancy. So this is where you're beginning to wonder, okay, how does getting drunk interfere with other things that they care about? Like maybe they're an exercise person. Maybe it's interfering with their academic goals. Maybe it's affecting their partner. Maybe it's incongruent with their religious values. You're beginning to wonder, okay, how is this negatively affecting their life? And I think this is why that non-judgmental stance up front will help you begin to get that from people. Because if I start working with this person and say, okay, tell me all the reasons why you like getting drunk, then they're going to already be more open to beginning to tell me what are some of the downsides of it, because I've shown them respect up front. So this is to boost self-efficacy. So this person, I really need to stop smoking weed because they got to drop urine with my team, but I've never been able to stop. So they're telling you it's important. They're just telling you they're not confident. So again, a different scenario. You find it hard to believe that you can stop and have a lot of reasons to try to find a way, including your scholarships. That's like a complex reflection. A darn question. I do this all the time with people. Tell me about another time in your life you accomplished something that you thought would be impossible. And it's amazing how activating even a non-related previous experience can be to a present scenario. I'm always astounded by how people will activate themselves based on their own past successes. Other things you can do are just like affirming strengths and abilities. Again, that's what I was trying to do with Jessica. Wow, you're really courageous to be so honest with me. Highlighting past successes. If I'd worked with her for a while, or I should have even said, hey, even you coming in and talking to a counselor, that takes a lot of courage. If you can do that, what does that say about you being able to talk to your professor? You can set small goals. So maybe with Jessica, if she was pretty hesitant, I may have said, okay, what if we just look and see office hours as the first step and see if you could even make the office hours? And then she comes back the next week and goes, hey, Russell, I looked at the office hours and I could actually make it at 3. Yay, that's really cool that you did that, right? Like just breaking the goals into small, manageable steps. Encouraging role models. I use this a lot too. Tell me about somebody who you relate to, who you identify with, who you've seen talk to professors, or you've seen make that change. What do you think you could do like what they did, right? Role modeling is incredibly impactful, but the idea is the person needs to relate to the role model, which is why I typically ask, anybody that you relate with, you identify with, you've seen do this. And when people relapse, it's normal. Everybody on this call right now, all 77 of us have relapsed. Maybe not on drugs and alcohol, but maybe on donuts, maybe on not going to the gym, maybe on whatever. We've all relapsed. So to catastrophize it is not helpful. It's important to empathize with it, but then to kind of turn it into as a learning experience. Oftentimes you have people sometimes who say, hey, Russell, cool talking to you, but I am not going to go talk to my professor. They're just giving you all kinds of pre-contemplation. So in my world, what you do is you just try and basically empathize with it through different ways. So go ahead, Kay. Okay, so this is kind of example. I really like smoking weed. It helps me relax and be more creative. I couldn't stop if I wanted to because everybody around me smokes. This person's giving you a whole bunch of I don't want to. So an amplified reflection is kind of like a reflection on steroids. You find that smoking really has a lot of benefits and you are not ready to find a way to stop. So it's kind of like it's just really trying to emphasize that unwillingness to change. And I only do that if the person's giving me a whole lot of energy around not wanting to change. Coming alongside is a little softer. You see little benefit to stopping smoking. So it's not quite as strong as smoking really has a lot of benefits. Emphasizing personal choice is another thing. You will decide when and how to change, if ever. I say that a lot to people. Shifting focus. Stopping smoking is not a priority. What else could we work on? So those are just different things that you can do. And the research, and a lot of times people don't want to do this because it feels like you're throwing in the towel. And that doesn't mean that I wouldn't have already been discussing it with them if they're open to it, me telling them like how smoking weed can affect them academically and but at a certain point you've done all that and they're saying, hey, I don't want to, then really what we would encourage in the MI world is that you then empathize with that. And what's really strange is that the research would suggest that student is still more likely to change than the one that you kept trying to educate into changing their behavior. Or even if that didn't happen, they're going to feel much more comfortable coming back and seeking you out if they decide that they are ready. I like to look at the research on people with serious mental illness, obesity, as well as substance use disorders. And I like to look at the research from those folks who are not engaged in counseling or help. There's 3 things that come up. One is finances or health insurance is one. Number 2 is transportation. And number 3 is they had felt disrespected in the past. So let's not disrespect people and try and create an environment where they feel like they can come back when they're ready. These are things you want to avoid generally. So persuading without permission. Hey, Jessica, I really think you need to do this. I really, my advice is you really need to do this. And it's really important you do this. And, I would say to her, hey, would it be okay if I try and tell you what I think you should do? But not just kind of unsolicited tell her what to do. Confronting people, typically not helpful. When you're thinking about confronting like a direct challenge, like, Jessica, you're just going to fail out if you don't do this. Premature focus, if I was too focused on one thing and like I was too focused on interpersonal effectiveness skills, but the client really believes what they need to work on is learning mindfulness, right? So we need to be open to people and let them try their ideas first. Labeling people, typically not particularly helpful. Blaming and shaming people, or educating people without listening. Okay, so you've gotten the person who says, okay, I'm going to make a change. So to strengthen planning, some of the things you may want to do is say, get them to elaborate more. Okay, well, how come you want to go to see your professor? How come you made that decision? Affirming, that's a really great idea. It takes a lot of courage to make that decision. I tried to do that with Jessica. Reflecting, you have many more reasons to access tutoring than to continue solo. Basically, the kind of idea is you kind of want to double down on their idea of changing. Also, I didn't do this with Jessica, but I said, what do you think would get in your way of actually seeing your professor? What do you think would, mess it up? And a lot of times students know. And it's okay. So if you wake up and you're really anxious and you're really scared that he's going to be demeaning toward you, what's a way that you can get past that and still go? So you're kind of building the relapse prevention plan into the plan itself. Who could help you with that process? Maybe she could talk to somebody who could give her a little gas to do that. And then summarizing. So an example of that again is you don't want to engage in group counseling because of XYZ, and you do want to engage because of ABC. At this point, the ABCs outweigh the XYZs. So would you like to schedule a group intake? And finally, when you're doing MI, you develop SMART goals. So specific, this was something that really somebody did with me. They didn't want to use alcohol and marijuana together. Measure, you could measure that to determine that was the case. Achievable, the person thought that they could do that. Relevant, the person thought that was relevant because they thought that's where most of the bad outcomes occurred. And timed, and we can do that over the next week and see how that's going to work for the person. And I think that's it. Yeah, so we got 2 pages of references. That www.motivationalinterviewing.org on the bottom there, that's a good resource for people. So thank you all so much for joining us today. Really appreciate you all hearing us out. Please let us know other suggestions you have for webinars coming forward. All right, y'all, take care of yourselves out there.
Goodbye.